So the pilot was introduced by Health Education England and NHS England with an aim to improve the patient care that can be delivered by community pharmacies.
Pharmacy Integration Fund delivers training for pharmacy professionals so they can develop their skills and prepare for new roles and new ways of working. There is now more joint working with peers across the healthcare system to deliver better and safer services for patients.
I absolutely love community pharmacy. It's a great job and I want to be able to give the best to my patients. It was something my boss brought to my attention at the beginning of the year, and because of newly being promoted to manager, she felt that it would be a good opportunity for me to meet other pharmacy technicians, either ones that are already a manager or potentially becoming a manager, to be able to help develop my own skills in the pharmacy setting.
It's never been more important in community pharmacy at the moment. There's a new contract that's being negotiated at the moment with the Department of Health for community pharmacy, which is likely to mean that we're more integrated with primary care and the wider NHS, so everyone's going to have to take on new roles. So it's really important to get the teams upskilled so that they can take part in the future in community pharmacy. For technicians, I think we've underutilised them in community pharmacy, so I think that this programme that Coventry University have really supported using them better.
So in terms of how the training course itself has been run, the participants have had 16 training days, taught training days, and as well as that they've had a lot of online learning resources, sharing of information from partner agencies and organisations, and guest presenters that have participated and brought a lot to the course.
So the key themes we've identified through this programme is how we can extend the role of community pharmacy technicians, not only in leadership and management but with their patient skills as well. How community pharmacies can have a better impact on the vulnerable in our society and how they can interact with them in a much more streamlined and focused way. We've also identified the impact that community pharmacies can have on patients and in their local communities, which is an untapped resource for the entire healthcare system.
Is a combination of the upskilling of the technicians, which has been very helpful, and giving them skills and confidence to support the pharmacy teams, but also the chance to take time out from the pharmacy to actually spend time thinking and developing the business. One of the key roles of the LPC is to support all the community pharmacy teams, and that includes quite a lot around development and training. And we're always looking to collaborate with different people to actually support this, because we realise we haven't got all of the skills in-house. We'd be interested in working more with Coventry University to support our contractors in the future.
Some of the real success stories has been the sharing of good practice and ideas amongst the group. So they've had really good ideas about how to reduce medication wastage, which is an enormous issue within the NHS, how they can take on greater roles within the pharmacy and let the pharmacists concentrate on their role within the service. I think that they've taken away a lot more confidence in their own abilities and confidence to make suggestions within their own pharmacy services about improvements, mainly for the patients, which is the focus, and also looking at new initiatives and services that the pharmacy can provide. So there's been a lot of sharing on social media and across the group with their own peers, which will continue after the course finishes.
I think by moving her forward on leadership and management, it gave the pharmacists a bit more time to focus on clinical decisions, and also it assisted me with the day-to-day running of the pharmacy. Leah's a lot more aware of the bigger picture to do with the managerial and the leadership of the team, and that's benefited everyone.
I would definitely recommend the course to other pharmacy technicians and their managers wanting to develop their skills, because it has benefit not only to the manager but obviously to the individual as well. If the community pharmacy technician is out developing their skills and techniques to come back and be a good leader and a good manager, then that has a great impact on the manager and the pharmacy and the work that can be done within that community setting. The better my community pharmacy technician skills, the better service I can give to patients, and especially being an independent community pharmacy, we're not a big chain, it's just us. We very much strive for patient-centred care, and that's obviously what it's all about.